Welcome to the Rapid Process Improvement Update.
Thanks, Arzu. What is that?
That's the output of a team of doctors, nurses, and techs who are brought together on your behalf to explore the process between the time that a care plan is developed to the time that we reach a disposition decision.
Well, it sucks when we have to run around looking for everybody all the time. I don't know who the doctor is. I don't know who the resident is. I have to look at the darn computer to figure that all out. What the heck is maple syrup disease? I tried to get on that computer, and none of them are working. What about that stupid phone today? I've been trying to text people. They don't get it. I don't know if they get it. Maybe they do get it. Oh my gosh, I am searching again. Why is the internet not working here? All of those things are things that make us so darn frustrated. Don't you like to know what's going on with your patients? Do you like to all of a sudden hear, you need to go in there and do a blood sugar, and then wonder, am I in the right room? Mm-hmm. These are all things that are important to us, that help us get our job done and help us to be good providers, good team members to our patients. Because you know what? We can never find each other, we never get a chance to talk to each other, and we surely don't work together as a team.
Well, you've got my attention, but what do I need to know?
For starters, we observed activity in the emergency room and came up with some ideas that we think will help. We're going to count on you to play an active role in putting these ideas in place. We think they are a slightly different twist on some things that we already do, ultimately resulting in working more effectively as a care team with the patients and families.
Geez, you're talking about change. You know how I feel about that.
Well, change is hard and uncomfortable at times. It's not going to be perfect, so it'll be a work in progress, but after a while we'll get used to it and we'll just be second nature. This space, it'll be a little hard, but when we move to the new space, it will be much easier.
What are you looking for us to do exactly?
Well, we're focused on two primary things: a process for bringing the care team together to discuss the care plan and use of a more comprehensive whiteboard in the room as part of this process.
Wait, this is sounding familiar. Didn't we try something like this last year?
That's right, Bob. We did try some experiments last year to try and improve teamwork and enhance communication. And we took the lessons learned from that experiment and we incorporated it into this week to design something completely new.
So then give me the details.
Okay, here's what we'll be doing beginning January 27th. Now, it's all written out, but we thought we'd just show you.
Currently, when a new patient comes to the emergency department, the resident will pick up the chart, go and evaluate the patient, come back, present to the attending, and a care plan is started to be formulated at that time. Our hope is to improve on that process so that the whole team is aware of the plan as it's being made and the families incorporated into that process as well. Now here's what happens next. Thanks for the patient presentation, Intern Rosen. Let's go assess the patient. Care planning to room 19. Okay, let's go.
Note that the decision maker, that's the attending, PA, APN, or fellow, is ready to assess the patient. So she did an overhead page. Care planning, room 19, entered the room, greets the family, notes her name on the whiteboard, and indicates that other members of the care team may be joining shortly and begins the assessment. Notice that the paging can be done using your Volt or phone. The decision maker does not wait for other care members. She keeps the flow going.
Hey, Julia, we're doing the planning team. I think it's about time we should go in now. All right.
There? Great, I'm just going to take a look at you right now.
Okay.
Paul, would you like to come in and we'll listen together?
Yes.
Hi again.
Hi.
We're part of the other care team members.
Sit forward for me, honey.
Great. Okay. So, you're definitely wheezing. I'm sorry that the epidural wasn't helping you too much at home. And I'm a little bit worried about pneumonia that I can hear on the left side of your chest.
What's that?
What is that? So pneumonia is an infection in the lung caused by virus or bacteria. We can't always tell which one is causing it, but usually we get a chest x-ray to try to take a look. So we're going to do a couple things. One is to help you with the way you're feeling, and then also try to get to the bottom of what's going on. Okay, so we're going to do a few more albuterol and Atrovent treatments together and give you some steroid medication as well to help with the inflammation. We're going to get a chest x-ray, see what else is going on, if anything, and then we'll check back with you in about an hour and see how things are going.
Hi, Lisa had asked me earlier what my concerns were. I'm just really worried she's going to be admitted.
Well, I think we're not able to make a decision quite yet. We'll have to see how she responds to the treatments and then see if we can sort out what else is going on. We'll be able to reassess that and after we've seen how she does with the medications.
Can she have a popsicle if her throat's sore from coughing?
Let's do the treatments first because I'm a little bit worried that the albuterol could make her nauseous and she might throw up.
Okay.
And one more question, pills, is that a problem for you?
Yeah, she can't do pills right now. If we can just do liquids.
Can you just do Orapred then for the steroids?
I'll put the orders in.
Great, thanks.
Okay. We'll be back in a little while to see how things are going and once we get the results of the chest x-ray back.
How long should this take?
Well, hopefully about an hour.
Okay.
Okay.
All right, and I'll be right back again just to make sure I got all this, but I'm just gonna go check with the team, okay?
Thank you.
When the care team heard that page, they made every effort to get to the room prior to the physician beginning to discuss the actual care plan. As the care plan is outlined, one member of the team can be making notes on the whiteboard, others can be placing orders. Note that the whiteboard will be wiped clean by housekeeping between patients and ready for your use. Appropriate pens will be available. If a member of the care team is in the middle of a procedure with another patient and cannot attend this discussion, hopefully an exception and not a norm, it's up to that member of the care team to follow up on what they missed by talking with another member of the care team. Note that the whiteboard can also be a good source of information. Immediately after the in-room discussion with the patient and family, the team steps outside the room.
Okay, so is everyone clear on the plan? She's going to get some NEB treatments and we're going to reassess an hour after they're finished. And then she's also going to get a chest x-ray. Will you let me know when an hour after the NEBs have been completed and when the chest film is back?
Yes.
I'll call respiratory and make sure that they come and start the treatments, and if they can, I'll get that going and give her steroids.
Great. And while we're here, that patient in room 12, have they started their PO trial?
Yes, they have.
Okay.
Yeah, and they're starting to take some sips, but I'm going to go in there and give a little bit more reinforcement and make sure that they're following the oral rehydration checkoff sheet that we have.
Great. So let me know in half an hour where we are with that, and we'll see if we can make the next decision with that.
Okay, great. Thanks.
This is for a quick validation of everyone's understanding of the plan and who's doing what. It needs to be especially clear who's tracking the next milestone and what action they should take. This is when issues and observations that weren't appropriate to raise up in front of the family should be discussed. This can also be an opportune time to touch base about updates and plans for other patients as necessary. The plan is carried out.
Dr. Taylor, it's been an hour. I just want to give you a follow-up on that patient.
Okay, great.
She finished off her nebs, and I checked the chest x-ray. It was clear.
Perfect. Let's go back and look at her and see if we can get her home. We just checked you. Everything looks great. The chest x-ray is clear, does not show a pneumonia, and it seems like you've responded really well to the treatments here. So we're going to be able to send you home with more albuterol every 4 hours for the next few days and 4 more days of the steroid medication. Okay?
Okay.
Any other questions at this time?
Can we get dressed?
Go ahead and get dressed, and we're going to get started on the discharge paperwork. Okay?
Great,
The
thank
nurse
you.
will be in soon. Terrific.
Excuse me, Lisa.
Yeah.
Julie, I just want to let you know that Dr. Taylor and I went back to check on Emma in room 19.
Okay.
And her x-ray was normal.
Oh, awesome.
And she's sounding clear, so we're going to discharge her home.
Okay. All right.
So I put in her orders with her meds.
Oh, great.
And that'll be the plan.
Okay,
She's gonna
awesome.
follow up with her pediatrician.
All right, great. And her vitals were all normal, so I'll kind of get started on educating the family about, discharge stuff, and then as soon as, maybe you can go get the paperwork, and then you bring it back to me, and then I can go in there and just get them to sign.
Okay.
All right?
Great, thank you.
All right, awesome.
Thanks.
Thanks.
Let's take a quick up-close look at the whiteboard.
The care team will be entering their names as they come into the room to introduce themselves. Other staff will be considered child life, social work, interpreters, volunteers, anybody that's not listed as the primary issues here. Care plan will be updated upon initial care plan or any changes in the care plan. Check marks should be placed once the actual care plan options have been done. Patient's name is not the name on the chart, but what they would like to be called. The date should be placed, and the diet as well. If they are NPO, clear liquids, or able to eat anything. Pain should be addressed. Any interventions for pain or even comfort. The room's too cold, they want some blankets is an option. And the question of what concerns can we address for you today should be written in the patient's words. What's next is our next step in the plan as far as your stay, disposition home, admission or discharge, or any additional steps after the next care plan huddle has been done.
Sounds good in theory, but is it really going to work? Well, we tried it out. Here's what we found and what we heard from our colleagues and teammates. People were concerned that it was going to interrupt their workflow and that it might take too much time, that they would end up backtracking on things that they felt they had to prioritize differently. Other people were really excited about being part of the team and working all together so that they knew what the plan was when the plan was being made and had a good time frame for getting their work done and talking with the family. All these concerns we thought about and tried to come up with some solutions for, and we hope that while you may have to step away and reprioritize some of your workflow, in the end it will save you time in terms of not having to run and search for patients and families and care team and wondering what the next step is with patients, and also being able to talk to families directly, knowing what the plan is and not being uninformed yourself.
So does it matter what we think of this process once we try it on for size?
Absolutely, you're part of the care team. The nurse, the techs, the docs, everybody in the ER is part of the care team. So we've trialed it a little bit. We have the next 30, 60, 90 days to kind of work out the kinks in this, and we need your opinion. So please come to one of us on the team or Dr. Taylor, who's our process owner, and let us know what you're thinking honestly and upfront, and don't sugarcoat it.
Interesting. I have some mixed emotions about this.
We know. And so what I want to do is share with you what one of our patients and families said about this process.
Okay.
This is important stuff. How everybody's here and involved in my daughter's care. It's like you put yourself in our shoes. The whiteboard relieves me from worrying, and I know what's next. It keeps me from waiting and wondering. It's nice to know the names too. I've been through this with my daughter before, and I see that you're doing what I know you should do. Builds my confidence and reassures me. I wish adult hospitals did this. This process is what makes AI special. I tell everybody that they'll never beat the care they provide. They really care.
So in summary, the care planning process is not only going to take 5 to 7 minutes of our time, but it's going to save us time and energy searching for people. It's going to improve the patient's feelings as far as if they're involved in the care team. It's going to increase communication among all the team members as well. So this process is going to work as long as we work for it.